over here, one of our graduating mentees, residents, Mr. Van Rouse. He chose the topic of voodoo medicine. Dr. Jones was looking to see where his chicken was. Apparently, I'm not sure. Maybe he doesn't have one today.
Can you hear me? Pretty good? Yeah. So I chose this mainly because last year, I don't know if y'all remember, not many people go to that, but I did the journal article. And that kind of opened the door for me on this part of the journal article was on acupuncture in neonatal abstinence syndrome. Kind of opened my eyes to a lot of practices that I didn't really get trained for in med school. And so I thought this was kind of interesting. I don't have any conflicts of interest. I'm not an expert in this by any way, shape, or form. This is not by any means to be anywhere near comprehensive to every type of practice that we're not trained for in med school. This is kind of just to get you guys kind of understanding what it means, what complementary alternative medicines are, some of the research behind what we have already, and really the main part, the part that I have a hard time with, is getting comfortable talking with patients about practices that you really aren't sure about or how to, where to go to find more information, that kind of thing. So just kind of some definitions. So complementary medicine is practices that are used in conjunction with conventional medical practices, and then alternative medicines are things that are used in place of. Generally minimal side effects, as you'll see a little bit later on. That's not always true for most things. May be more cost effective if we use them in conjunction with. Now that there's more research going, a lot of these definitions of what is conventional medicine, what is alternative medicine, those lines are blurring nowadays. And there's an actual new definition of integrative medicine. There's 25 fellowships in the country for integrative medicine. Anybody can go into it, any physician, nursing, pharmacist. Their idea is to make use of all available and appropriate therapeutic approaches to promote optimal health and healing. They try to employ evidence-based practices to treat the whole person and not just one specific symptom or one specific disease. Who uses complementary alternative medicine? We'll call those CAMs from here on out, just to kind of shorten things. This is an older study, but somewhere around 20% of children use them, and 66% of those don't tell their pediatrician. Highest use is in non-Black. This is just across the board in the adult population as well. Obviously, 25 to 49-year-old, higher education, higher income, and those that have chronic medical conditions, cancer, asthma, ADHD, autism, those type of things. So why do people use them? A lot of doctors, including myself, before going into this, many of us believe that patients are going to abandon conventional medical practices because they're unhappy with the mainstream medical care. Multiple studies have been done on this. There are still patients who will decide to do alternative medical practices, but a majority of patients that use CAMs, they're actually more compliant with the stuff that you're going to tell them to do. And there's no study that's actually across the board shown that patients use conventional medicine less when they use complementary medicine. And the AEP put out a statement, patients use CAMs not so much as a result of being dissatisfied with conventional medicine, but largely because they found these healthcare alternatives to be more congruent with their own values, beliefs, and philosophical orientations towards health and life. So, it's an old study, but in 1997, visits to CAM providers exceeded PCP visits in the same year. And that's, you'll see what I talked about. And then 127 million in 2004 was spent on the visits and 22 million on the remedies. And that's increased significantly over the past few years, but there's no data for that, what it looks like now. Thank you guys for filling this part of it out. So our residents, very few of us are actually very comfortable with it, or even somewhat comfortable. Most of us feel really uncomfortable when it comes to talking to patients about complementary medicine. And if you look at 20% of your patients are using it, and you're not comfortable talking to them about it, and there are some side effects, then there's a disconnect there. And it's even worse about what we know about it and how confident we are about our knowledge in complementary medicine. So more than 20% of us believe that we're complete idiots in this field, and I was one of them. I still am one of them. So what is the research? Is there any research behind these complementary practices? I think this was 2013. There were 1,400 randomized controlled trials and 47 systemic reviews. They did show that the quality of the randomized controlled trials was as good as conventional medicine. There's an opposite bias in the U.S., whereas if you look at conventional medicine research, a majority of what's out there is positive, so it actually works, that kind of thing. When you look at CAM therapies, negative studies are more likely published in well-known journals, and positive studies are more likely in foreign language journals. Some of this is to do with foreign, like traditional Chinese medicine and that kind of thing. It's done in places, and done more in places not in the U.S. The problem with research is that there's heterogeneity in both products and practices, so you'll see a little bit later on there's not really a set amount of medicine in certain things, and people practice acupuncture and massage therapy a little differently in different places. And then when it comes to actually publishing these things in like Peds in Review or Pediatrics, finding someone to do peer review is harder in this realm. This is very simple, but it's not something that I actually thought about until I looked at this table. So I wish I would have been Cohen put that together. So what do we do when somebody approaches us with using CAM therapies? So what do we tell them? Do we have to prove that these things are effective before we can tell them that they can use them or that they're okay to use? And they say no. I mean, big thing is this therapy safe? If the therapy is safe, then you can either recommend it or tolerate it based on whether or not it's effective. Obviously, if the therapy is not safe, monitor it closely or discourage it. And then, like I said, this is very common sense stuff, but this is the way that we need to think about these things. And this is what I want you guys to use as we go through each individual therapy. Think about, is it safe and is it effective? Can I recommend it? Can I say it's okay to use, or should I tell them not to use it? So here's some of the categories. Homeopathy, like cures like, increased dilution increases potency. The biologically based practices, those are your vitamins, herbs, dietary supplements, diets, and foods. Manipulative and body-based practices, so chiropractic and osteopathic manipulation, massage therapy. Mind-body medicine, so relaxation, visual imagery, tai chi, yoga, meditation, prayer. And then biofield therapies, those are your acupuncture, magnet therapy, and therapeutic touch. So we'll kind of go, I'll try to kind of break it down based off of each individual category. So homeopathy was developed by Samuel Hahnemann, I cannot say that name, in 1790. The theory is that highly diluted substances that usually cause symptoms at higher potencies cure symptoms when they're diluted. And they actually believe that the greater the dilution, the greater the potency. There's a wide range in the usage, but anywhere between 2 and 10% of kids are using this, or their parents are giving it to them. Things that they tout to treat are respiratory problems, teething, otitis media. Their claims, and most claims, are that the concentrations are so low that they cause no side effects, but we'll see that it's not always the case. So one of the newer, I think around October, this kind of came into the media, but it's been going on for a while, these HYLAND teething tablets. So here's what's in them. Words that none of us, personally, I don't know unless you do herbology. But here's what they tout treating. So Calcarea, phosphorica, teething, dentition, chamomilla, irritability, coffee cruda, sleeplessness, and belladonna, restlessness and teething discomfort. These are not how much they've diluted them, but there's like a standardized formula based on homeopathic medicine practices that I didn't understand myself, and we're not going to go into in particular. But know that for most dilutions, the idea is that if you try to find the molecule and the amount of volume that it's there, rarely do you actually find the molecule of any of these substances. That's the thought behind a lot of this. So what happened? FDA investigated after a father reported it through MedWatch. It was pulled by the market by the manufacturer in October 2016, and when the FDA looked at it, there were more than 400 adverse events reported over a 6-year period, and that was just for those teething tablets. Some of the main things were seizures, tremor, fever, shortness of breath, lethargy, vomiting, agitation, and irritability. So what happened? When they went back and actually grabbed and tested the products, there were inconsistent and sometimes extremely high level of the Atropia belladonna, which is also called deadly nightshade. And that's an anticholinergic. So it has atropine, scopolamine, and hyoscyamine. And so that was causing a significant amount of problems. And that's the plan. As you know, it makes it a little bit dilated. I wish. So after that, because the FDA finally went back, in April of this year, FDA finally took a ban on it. So it was pulled from the market in October, and the FDA banned it. But after about 5 minutes online, you could find it. I mean, this came to my house yesterday, so it's really easy to find still. So these things are not just because they're banned and that kind of thing. That came from eBay, but still.
Had it been open previously?
Let me see. You make me think. It might have been. I don't know. It might be leftovers. Who knows? Or somebody bought it. No, it still has the tamper pack on it. So somebody bought it knowing that they were going to make money off of it. So what is the bottom line for most of these? Most are not poisonous. Again, remember the idea is that if you look into it, there's not supposed to be, there's supposed to be very little, if any. But sometimes you have to look at the diluting substance that they use. Some of them use alcohol and some use honey. You know, we can't use honey in kids less than a year. And there are some allergic reactions that have been seen with this. So if you think about it, there are some side effects. There's not really any of the molecule in it. There's no real good data on whether or not these things work because it's not consistent on how much product is in it. So would not be one of those things you should recommend across the board. But if it's done right, it's not something you have to say completely you have to take off.
Can these fall under the category of nutritional supplements?
They don't. No, because the idea is that it's supposed to be diluted to the point where it's not. So homeopathy is completely different than your biologically based practices. So that's the next part that we'll talk about. This will be one of the bigger parts because there's a little bit more data on it back and forth. So who regulates these biologically based practices? So they don't need FDA approval to go to market. So they don't have to go through these rigorous studies to make sure that they're safe. No phase 1 and 2 trials, that kind of thing. The manufacturer, all they have to say is that the ingredients are reported as reasonably expected to be safe. Again, and when there are adverse events, the manufacturers aren't required to report them to the FDA. There's a voluntary reporting system, that MedWatch system that we talked about a little bit earlier. And then in order to restrict its use, so in October they find, and this is for the other medicine, but it also kind of goes for these as well. In October they find adverse events. It takes all the way till April for the FDA to pull it from the market completely. So they have to prove completely that it's unsafe before they can take it off the market, the FDA can. They can put out statements saying that there may be adverse events, that kind of thing, but as far as removing it, they can't. Any claims to prevent, treat, or cure disease is prohibited. So they can't say that on the thing, but they can say something about the supplement's effects on the structure and the function or the general well-being of the body. And they must contain that statement that you've seen on a couple of things. This statement has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. And that covers them liability-wise until there's a bad event. All right. So a little case. Mom brings her 13-month-old previously healthy male to you for cough lasting for the past 3 days with runny nose and congestion. You diagnose him with a URI that's been going around that year. She's tried Vicks VapoRub, bulb suctioning, and a humidifier, but nothing's working. Nobody slept in the past 3 nights because of consistent nighttime cough. And she wants to know, what else can I do? What do you tell her? You just tell her, you have children. They'll get over it. It takes a couple of weeks. These coughs will get better. So one of the things you can recommend that's actually been proven to be beneficial is honey. The reason why it works, we don't know. So it does have some antioxidant properties and increase in cytokine release. There's a really good randomized controlled trial. They took 1 to 5-year-olds with nocturnal cough from a URI. Those kids didn't have asthma, pneumonia, sinusitis, or allergic rhinitis, so they were taken out of the study. And they double-blinded them to either a placebo, which was it's a date extract, which looked very similar to honey, tasted very similar to honey, but was not honey, and then these 3 types of honey. Very busy slide, but what I want you guys to focus in on is, so this was the first night, these A, B, C, D columns. So this is the first night for each one, and this is the second night. A, B, and C are all those 3 different honeys. So eucalyptus, I can't say that, and citrus honey. So if you look at it, and if you look at cough severity, this was done by a survey on the second night. So cough frequency, severity, bothersomeness to child's sleep, parent sleep, and the combined symptom score. These are the honeys, and this is the control. And every single one of these had p-values less than 0.001. It was statistically significant across the board. So how frequent was your child's cough last night? How severe was your child's cough? How bothersome was the cough? And how much sleep did you get? How much sleep did your child get? And so what does the AAP recommend? Obviously, no honey for children less than a year for the infantile botulism risk. Anywhere between half to a teaspoon of buckwheat honey, alone or mixed in a non-caffeinated beverage. There are some, those kids that have chronic cough, can you use it long term? The only risk that a lot of the experts are saying is for caries. That's the only big concern that a lot of them have. What about multivitamins? So there are specific recommendations when these things are needed. There's specific neonates that need vitamins, vitamin D for breastfed infants, and then those picky eaters. So those kids absolutely need a multivitamin because they're not getting what they need from their diet. Just know that not all vitamins are safe. We do know that toxic levels of vitamin A causes liver damage, elevated ICP, poor weight gain. Vitamin D can increase your calcium levels, causing metastatic calcification, fatigue, constipation, irritability, and vitamin C causes kidney stones, diarrhea, nausea, headache. So these things are not terribly safe. The one thing that you need to be careful of is these megavitamins. These have large doses of these and other vitamins in them that are touted to treat dyslexia, hyperactivity, and mental retardation. So none of this has actually been proven to work, and we do know that there are side effects like we talked about here. So what is the bottom line? Most kids don't need a multivitamin. If you eat a well-balanced diet, you're going to get what you need from it. But I don't know about most of you guys, that was what I grew up on. Those Flintstone vitamins were all over the place.
That explains a lot.
Kind of does, right? I mean, Anyway. I'm going to move on to probiotics. It's another kind of new realm of things. These are just 3 of the ingredients in probiotics. There are some others out there. These are the ones that are best studied. Lactobacillus and Bifidobacterium, or bacterial probiotics, and then Saccharomyces boulardii. I should have gotten with you before these. I don't know if you could have helped me, but that's a fungal stuff. How they work, we don't know. So whether or not they prevent colonization from other bad bacteria, whether they produce acid and short-chain fatty acids, whether they regulate intestinal transit, normalization of microflora, all of these have been touted as possible ways that these things work. There was just a combination of a bunch of randomized controlled trials. There's a review of them. I'll summarize that pretty briefly in here. So what about acute gastroenteritis? Can you use it? There was 1-day reduction in duration of diarrhea. Not bad. What about prevention of antibiotic-associated diarrhea? The number needed to treat was 13. That's really low. You guys think about that. We'll talk about the side effects in a little while. Does it prevent URIs in daycare settings? Not really. Does it prevent allergy, like food allergies and atopy and eczema? There's not been any data that says the food allergy part of it works, but there may be some benefit in eczema, especially high-risk children. The kids that they did this with were families that were atopic families. The moms took probiotics prior to delivery. They were breastfed moms. They took probiotics after delivery, that kind of thing. What about inflammatory bowel disease, y'all's realm of the world? Limited evidence, but it is positive for ulcerative colitis. The evidence is not as great for Crohn's, that it actually works. There's some more stuff. What about prevention of neck in the NICU? Any of our colleagues here? There was a Cochrane review that showed that a reduced neck stage greater than or equal to 2 in all-cause mortality, reduction in time to full enteral feedings, but there's a caveat to that, and we'll talk about that in a minute. Infantile colic, which is something that you'll see regularly come up on this because that's one of those things that parents are trying treat. There's promising data in breastfed infants, surprisingly, but the role in formula-fed infants, the data is not as clear for that. Irritable bowel syndrome probably has some of the best evidence behind it. It significantly reduces pain and improves quality of life. And then functional constipation, there's limited evidence, but it's really not that good for constipation. So there are some benefits. So why not give it to everybody? There have been really significant case studies of fungemia and bacteremia linked to probiotic use. The ones that it did pop up in, again, we talked about that prematurity risk, but kids that are immunosuppressed, so don't give this to Dr. Drudy's patients that are on chemotherapy. Kids that are very sick, structural heart disease kids, why that's the case, we don't know. Hospitalized patients, so there were some hospitalized kids that were previously healthy that ended up getting bacteremia or fungemia, those with central venous catheters, and those with an increased risk of translocation of probiotics across the bowel wall, which kind of brings into question whether or not you should use it in people with inflammatory bowel disease and that kind of thing. Okay. Good. Sure. Absolutely.
I think that it's important to know the rationale and why are these particular probiotics being chosen, especially Lactobacillus and Bifidobacterium. Remember, those are early colonizers of the infant GI tract, and the idea is that, and there are more studies now to show that different spectra of microbiota are associated with more likely colic and other things in the question of neck. And so these two, particularly Lactobacillus and Bifidobacterium, are commonly found in breastfed infants and thought to be sort of representative of the good flora, more often than bad flora.
Yeah, that's the idea.
You start to use antibiotics, these types of bacteria are very sensitive to many of the beta-lactam antibiotics that we use, and we alter the gut flora in ways that we're only just beginning to understand.
What about the fungal?
The yeast, I don't know really the rationale there. John, do you?
Not really sure either.
I think it was just.
Normally, so general rule, the most likely cause of antibiotic-associated diarrhea is not is the sugar of the antibiotic, and not that you actually mess up with the microbiome. You will, but it's not the cause. Number one. Number two, if you are going to give a probiotic to a patient that is on antibiotic, in my brain, it's easier to give a fungal patient because you're not going to kill it with the antibiotics because the reason you just gave. The first two are more sensitive for beta-lactamide, which is what we use for, it's our club ship for anosmia and things like that. So,
But it works. Even using the bacterial stuff did work.
Rotavirus in infants and give them lactobacillus and
there are good trials done from University of Chicago that it actually works by reducing the sick days in rotavirus, for example, specifically rotavirus.
Yeah, I didn't put that up there, but that was in there too.
But again, this is part of the ones that are not FDA regulated, so there will be a big variation between doses, between one capsule and another.
Yeah.
And as for my knowledge, there is no good standard of how many cultures or what's the unit, how many units of bacteria you should give in order to achieve a specific.
And what's the best route of administration, encapsulated to pass the GI, the stomach, and get to where it needs to be done? And that's you'll notice that's the problem with most of the supplemental stuff. Is it's just there's not standardization between each. The problem is there's not standardization between 2 pills in a bottle, and there's not standardization between 2 different companies, just because they're not required to do that.
If you give them the Tramagen, I forget now if it's the liquid or the powder form, it's built in by the company.
Yeah, Similac's doing that now for their regular formulas too. They tout, I think it's lactobacillus that they're putting in their powdered formulas that you can get over the counter. So, we'll move on to one of the next ones. One of the ones that your teenage kids are going to use is creatine. That was really heavy when I was in high school. That's been a long time ago, but probably it's still there. So young athletes' usage rates in between 5 and 30%, depending on if they decide to disclose it or not. The idea is that it increases phosphocreatine stores, and that's the phosphocreatine stores are used to recharge ATP. It does increase lean body mass. It does improve performance for sharp bursts of exercise and maximum intensity. So things like shot put, the 100-yard dash, sprinters, that kind of thing. There are case reports of renal failure. All of those case reports are in kids with underlying renal disease. So these kids were not normal to start out with. They weren't a normal host to start out with. The issue is that they're not banned by the NCAA, so they can take these, but they have to be careful because even the ones that you can buy over the counter are contaminated with other substances. And I don't know if you guys follow any kind of sports-related stuff, but there's been multiple athletes, professional, college, who've been found to have substances that they weren't supposed to be taking, and they didn't realize that they were taking it. They thought they were taking a supplement that was completely benign, safe, and okay to use. One that's really common in your patients is gripe water. That's in my cabinet right now. My wife uses it fairly regularly. Developed in the 1850s by this guy Woodard from a malaria drug. He used dill seed oil, sodium bicarbonate, and a significant amount of alcohol. There's no single recipe nowadays, but a majority of them don't have alcohol in it. That's kind of the thing. So here's some common ingredients.
It work as well without that.
Well, but it also has vegetable glycerin and some fructose in it. So that we'll talk about. That's not something that's been researched, unfortunately. Whether or not it's the actual sugar that makes these babies feel better and then they fall asleep. Because, you know, we do use baby crack pretty regularly around here. But dill, ginger, fennel, chamomile, agave, sodium bicarb, and Chinese star anise. These are just some of the products that are found in gripe water. Here's what it claims, and these are really good claims. It relieves gas, colic, and hiccups. It's safe, natural, and effective, and it's fast-acting, works in minutes. If you look online, there's some really great testimonials for all these things, but this is one of the best ones. I called my pediatrician and asked if I could give it to her. She said yes. Within 15 minutes, I had a new baby. I got to see her smile for the very first time because of your gripe water. Who wouldn't use it, right? So this is not the greatest study. There's a caveat behind this, and I want you guys to take this with a grain of salt. But this is kind of the issue that there is out there with some of these studies and some of the reported studies. So 355 kids total, 215 gave gripe water, 120 didn't. Just a survey. They didn't tell certain parents to give it, certain parents not to. They just found who gave it. Reasons for giving, 81% of them believed that it helped with digestion, 27% said it prevents stomach ache, and 18% insistence of their elders, which is pretty common. I have that in my own personal family. 15% just believed it was good for health. The ones that didn't give it, 60% of them, their doctors told them not to. 16 said they didn't know, and 12 felt it was harmful. 12% felt it was just useless. So what did their study say? Weight gain was no different. They increased in colic in those patients that took gripe water and increased in constipation. No significant increase in spit up, fever, cold, non-significant. So they're still increased, but non-significant. In fever, colds, and loose stools. And this is their amazing chart that they put on there. During their research, infantile colic, look at that. I mean, those that gave gripe water, they had significantly more colic, and those that didn't. And constipation was significantly different. But what's the problem with this study? Selection bias, right? Confounding biases. Why did they give the gripe water in the first place? Did they give it just because the babies are more colicky? There was no randomization whether or not they were bottle-fed versus breastfed. There's no standardization in the gripe water formula that they recommend. They just said, did you give gripe water? So what does the AAP says? Unfortunately, they say more research is needed. So what's the problem? So are they completely safe? There are reports that they've been contaminated with Pseudomonas and Cryptosporidium. There's minimal literature that touts its benefits, and there's multiple different preparations. If you guys look at there's a Japanese star anise, which is extremely toxic. There was one formulation that came from China that ended up having that in it, and these kids had seizures, and a couple of them died. So, should you use it? It's kind of up in the air still, and it's still pretty prevalent. I don't know if anybody's seen their family members or any of their patients using these amber bead necklaces. It's also a new kind of trend. What does the AAP say?
They're filled with honey, right?
Yeah, right? I wish. The AAP says no. Absolutely not. And the reasoning behind it is not because of what you would think. The AAP says don't give kids jewelry at all. Kids shouldn't have earrings, they shouldn't have necklaces and those type of things just because of their choking hazards. What do they claim these amber beads do? The body heat itself is supposed to release succinic acid that stimulate the thyroid gland to decrease drooling and to relieve pain and inflammation. there's never been any evidence that succinic acid itself relieves pain or inflammation. And there's, surprisingly, as prevalent as these things are, I don't know if you guys have seen them, there's only been one report in 2016. A kid got strangled but didn't die. There was no, I want to say the kid was neurologically intact at the end and there was no issue behind it. But again, not been proven to work. The medicine that's in it that they say works doesn't actually do what they tout it does, and there is a risk of side effects. So we're going to move on to some of the less medical stuff and medicine stuff and more of the manipulative and body-based practices. This is the stuff that kind of surprised me a little bit more with doing research. So chiropractic and osteopathic manipulation and massage therapy. We'll start off with massage therapy. A randomized controlled trial of massage versus rocking for colic. There were 100 kids, 50 of them got rocked, 50 of them got massaged. They tried to make sure that the time that they got massaged and the time they got rocked didn't change the amount of interaction that they got with the child care, with the care provider. The moms were trained by a trained individual, and you'll see a little bit later why that's important. Babies did use oil with massage, and the rocking group was advised to rock at least 3 times a day and any time that the kids have colic. The massage group massaged 3 times a day and then any time that the kid had colic as well. Any kid that was getting any kind of treatment for colic, if there was smoking in the family, not the kid, but the parents were smoking, skin disorders, milk allergy, or any kind of proven GI disorder, they took those kids out. It's really good. I would say that the data behind this one was really good. So the length of crying before and after for massage group, so this is massage, this is the rocking group. So before, you're looking at 4 hours versus 1 hour of crying, 3 hours versus 2 hours. The length of sleep was significantly different between the two, significantly improved. Although if you look at the rocking group, there may have been an issue with that because they had a significant more. But even doing statistical analysis, it was still statistically significant. And the cry severity was better. The problem with this study, again, is that it wasn't blinded. Parents knew, and these are subjective, maybe not the hours of sleep, but the length of cry is really a subjective thing. Your kid's crying, you think that the kid's crying for hours on end, and it may just be 15 minutes. What about in the NICU for preterm infants? There were 34 randomized trials that this review article looked at. The benefits that they did notice. So there was significant difference in weight gain. So kids that got massage therapy got significant weight gain. One of the randomized controlled trials actually took the fat out of one of their massage oils. Those kids didn't gain weight. So that may be that the fats themselves are getting absorbed into the skin is what they were claiming. Now, whether or not that's true or not, that needs to be looked at a little more. Did improve gastromotility and improve bone health. There was no difference in the caloric intake, number of infections, or sleep efficiency. There are some improvements in neurodevelopmental categories at 2 years of age. It depends on which test they did for the kid. One of the testing did really well, and the other test didn't really show a lot of benefit. And there are some that say the hospital length of stay is decreased, and some say it's about the same. This is actually being used fairly commonly in big centers nowadays, this massage therapy.
So I just wonder.
Sure.
If it's actual the oil that is helping, or it's just the bonding between.
So a lot of these studies did.
Bigger centers are using kangaroo
Yeah.
care for
Right.
even for premature babies. They put skin-to-skin care, and there are trials that suggest that the heart rate and blood pressure, but all of our such will improve in those premature that are in skin-to-skin contact with
But
bone.
not all of these studies did it, but a majority of them tried to adjust for that. Either giving them some type of skin-to-skin care, or some of them did sham massage. So they did some touching, but it wasn't true, like trained massage therapy. And so even those studies showed a pretty good benefit. It was interesting. Other benefits, these are randomized controlled trial proven benefits. Anxiety reduction in psychiatric patients, improvement in ADHD symptoms, improvement in depression, improvement in lung function for asthmatics, and improvement in chronic non-malignant pain. I mean, if you're hurting because you have bone pain from cancer, you probably need an adjuvant therapy as well. So is it completely safe? Can you do it on everybody? Should every single parent be told that they need to massage their baby? local pain and swelling. If you do it without oil, that was most of what they noticed. Mild fever, skin rashes. This is the part that scared me. If you're not a trained individual or you're not trained to do it, there's 7 case reports of untrained personnel causing volvulus in newborn infants. How that's the case, we don't know, but the case reports were pretty.
Well, you have to say, did they truly have volvulus?
Yeah. Were they massaging the abdomen?
Yeah.
And we know now that a lot of kids and adults can have intermittent volvulus.
Mm-hmm.
Then it's not so bad. In fact, I found out here that when adults come in for trauma, it's fairly frequent.
Mhm.
One of them told me they don't report it anymore. It just
Really?
costs too much problem.
So that may just be a random,
Yeah.
non-significant finding. Okay. Good to know. All right. Some of the other stuff. Relaxation, visual imagery, Tai Chi, yoga, meditation, prayer, and hypnosis. So what about yoga? Generally safe. No adverse events from 34 controlled trials. Areas that it has studied is physical fitness, cardiorespiratory benefits, motor skills and strength, mental health, IBS. Birth outcomes, largely positive. None of them have been that significant. But then again, there's no randomization, standardization. I mean, if you're going to do yoga, unless you get sham yoga, which is going to see someone and they're just going to tell you to do things that are not true yoga practices, it's really hard to double blind these kind of things. Generally safe, though, so do you have to say no? It's also expensive for a lot of these things. What about meditation? Reportedly used by 3% of children. There's 3 types: concentration on a word, thought or sensation, image, mindfulness, notice experience that arise in each moment. Movement include yoga, mindful walking, and Tai Chi. Across the board, these things are safe. And there's actually been some proven benefit in reduced blood pressure, improved attention and behavior, and improved psychological functioning. A lot of psychiatrists are using this nowadays in their general practice. What about acupuncture? Collectively, a family procedure is used to stimulate anatomic points on the body. Our general practices incorporate practices from across the board: China, Japan, Korea, and some other places. There's a lot of different ways to do acupuncture, whether it's needle therapy, shiatsu massage, heat, lasers, magnets, acupressure, or electrical currents. These are the places that it's actually been proven to be significantly better for. One of the best known is chemotherapy-induced nausea. There's really good data behind acupuncture for that. And then post-anesthesia, post-anesthetic nausea. And then pain, allergy. There's actually a trial that's worked. And neonatal abstinence syndrome. I like that one just because I threw that one in there. That's what brought me here. So what are the risks of acupuncture? Soreness, organ injury, especially the lungs. They've had pneumothoraces, infections, and then kids that have coagulopathies obviously shouldn't get acupuncture. Again, that's with those organ injury and bleeding with coagulopathies, mainly with the needle acupuncture. Infections are a lot less likely nowadays because acupuncturists use sterilized needles, that kind of thing. One that we need to be careful of is chiropractic care. Why do we need to be careful of it? If you look across the board, Medicaid covers chiropractic care more than any other practice. The subluxation theory of chiropractic care. Misalignment with the vertebral column causes multiple medical problems, and health can be restored and maintained by adjusting the spine. Chiropractic care can never start too early. That's according to the International Chiropractic Association. How often do we use it? 14% of all chiropractic visits were for pediatric patients. Here's what they claim to treat: asthma, otitis media, allergies, colic, enuresis, cerebral palsy, epilepsy, and myasthenia gravis. So the only one that I'm not going to talk about is otitis media. That's actually the only one that's been shown, if you go to a chiropractor, it can improve your otitis. A lot of people believe that just the adjustment of the spine itself, at some point, adjust the eustachian tube, and then you get better drainage. Possible. What about for asthma? Multiple randomized control trials, 0 benefit for asthma. Colic, no more effective than placebo. Enuresis, there's great trials. You start chiropractic care, these kids stop having enuresis. but it's equivalent to the natural history of the disease. So if you didn't do it, they probably would have gotten away from it already. And then no evidence for the others. Some evidence in treating chronic back pain, mainly in adults. So why not just let everybody have it? 13 studies in 2004, 14 significant manipulation injuries, subarachnoid hemorrhages and paraplegias, 2 fatal injuries, brain hemorrhages and dislocations. The one that scares me the most is that patients that go to chiropractic care can delay their treatment to a general pediatrician. So 2 deaths from meningitis, delayed cancer diagnoses, and then incidence of back pain in pediatrics is rare. Whether it being organic back pain, just back pain by itself, and not secondary to another cause is rare. And you shouldn't, obviously you shouldn't x-ray a neonate. That kind of thing. Well, the other thing that's kind of well known nowadays is cupping. If you guys watch the Olympics, every one of the U.S. swimmers was doing it. Claims to treat acute congestion, pneumonia, pulmonary edema, nephritis, and musculoskeletal pain. How do they do it? Application of a vacuum to the skin, either via vacuum itself, like a vacuum pump, or sometimes they burn alcohol and pop it on the skin. There's no randomized controlled trials that prove its benefits at all, across the board. Most data in the adult world, most of the data is in the adults, but most of it doesn't show any good benefit. And then, obviously, if you do the alcohol part of it, you can burn the skin. You can get paniculitis, so that's inflammation of the actual fat tissue and then bruising of kids. Do know that this does happen regularly. This will come up in your boards, possibly. They'll show a kid with these circular bruising, and it's not child abuse, technically, because they're not trying to harm their kid. Let's see. It's probably our last one. Essential oils is fairly new. It's kind of come out. It's kind of the new hot topic. Organic compounds extracted from plants and concentrated. They claim to fight cold, flu symptoms, relax body and soothe sore muscles, heal skin conditions, and improve digestion. Most of these are used via aromatherapy. Sometimes they're used topically, and they're rarely ingested or recommended to be ingested. What's the problem? Are there any benefits? Most of it's anecdotal, that improves blood pressure, nausea, and pain. Mixed results in clinical trials, and then the lack of standardization makes it difficult. The risks of it, so lavender and tea tree, if you use it too consistently on the skin, can actually cause breast enlargement in men. Pennyroyal oil is toxic. Oil of wintergreen, that's our aspirin equivalent. Nutmeg can cause hallucinations and coma if you use too much. A little bit of nutmeg in your food is not a problem, but if you concentrate it and put it in the oils. Sage oil causes seizures, and camphor oil causes seizures as well. So, medical legal issues. So can you be sued for using or for recommending these things? So provider recommendation and use of some alternative therapies in adults has been judicially held as medical negligence and was believed below standard of care. So they did lose lawsuits and had malpractice issues. There's a flip side to that. It hasn't been shown to be done yet, but let's say you don't recommend CAM therapies or you don't bring them up when you're talking about informed consent. They may, at some point in the near future, need to be included, and you may be in trouble for that. The case report that they talk about on this one, it really doesn't, that the AAP talks about when the AAP cites when they do this one, it's not really relevant to this case. It was an orthopedic surgeon, a lady broke her hip. He recommended strict bed rest, didn't talk about surgical interventions. She couldn't walk after that, and they said, well, since you didn't offer or you didn't talk about a therapy, even though you weren't going to recommend it, then you're still liable because she couldn't walk anymore. And so whether that will actually translate to this, probably not. And then alternative therapies for life-threatening conditions, should the parents use them, could be deemed neglect. What do you tell your patients? Or how do you talk with your patients about it? So the prevalence of its use and the possible side effects necessitate us to inquire about their use. I don't know if I've ever found a patient, other than some of the multivitamins, some of the gripe water, these other therapies, I've never had a patient tell me that they actually use it. Be open to the family's perspectives, values, and cultural beliefs, centering the conversation on the patient's well-being. So don't tell them And it's not our job to prove that these things are completely effective, but it's our job to make sure that they're safe. And as long as you bring that to your patient in that realm of it, it's a much better conversation. Maintain current knowledge on popular therapies and the evidence behind them, and keep an open mind about it. And this is something that I had to learn fairly quickly, that these therapies that I always thought were just stupid voodoo medicine, something that those other people use in California, they're actually, a lot of these are effective, and a majority of them are safe. Where do you go? So the National Institutes of Health made a Center for Complementary and Alternative Health. There's a website for that. It's updated regularly. AAP now has a section on integrative medicine. And then there's the Canadian Pediatric CAM Network. And some of the stuff that we went through to. Questions? Sure.
And just a quick comment. One of the other reasons to ask about these is interactions with medications we may use.
Absolutely.
Think of the St. John's wort and I guess antidepressants especially and other things. So that's a big area of concern. But remember the case you put up there. What was the complementary thing that was in your case already? Vicks VapoRub.
Yeah.
You know, and a lot of things that we don't think about, you
Yeah.
know, are sort of fit in that category. There is a little evidence for Vicks VapoRub now, but it's a traditional kind of approach.
Well, and that's the issue with a lot of these things is there's a lot of medicine practices that we use now that were just traditional and they weren't mainstream medicine. They just get incorporated into it. So
I think if you're going to try these, it's worthwhile to remember if the enthusiasm of the doctor's recommendation has a placebo effect.
oh yeah.
And it's very, very, very strong. So if you're going to use them, recommend them with a little bit of doesn't.
And probiotics have come a long ways in the past 20 years. I mean, 20 years ago, the studies on, if you went to the nutrition supplement store and bought what was advertised as probiotics and actually tried to culture bacteria, there was nothing there. It was alive. And so,
They don't have to either.
They don't have to prove that there's
That's
any live bacteria, but the way I put it to my patients, because now I do recommend those sometimes, is that basically probiotics now are worth what you pay for them.
Yeah.
That the better ones are the more expensive ones, and there are some that are on formulary, and some that have gone through more rigorous testing to make sure that they are actually probiotic and have a positive effect.
Yeah.
The only important thing is that we shouldn't be ambivalent to
Right.
this as physicians.
Yeah.
And I learned this when I came to this country before. I said, I don't care if this is not medicine, I don't care. Whatever. But like Dr. Leger said, it will induce your starting from P450,
Right.
which will affect the medicine that you're actually prescribing. So we as humans like to be in control of our own decisions. And when we get sick, especially with a chronic illness or a life-threatening condition, we lose that control.
Yeah.
And we give that control to someone else who we don't know and we might not even like. So most of these patients might, in an attempt to regain...
All my patients like me.
Africa. Oh, okay. I think I should have done like GI psychiatry combination, something like that.
Oh, I thought it
That's
was
basically what you do.
I slept halfway through the fellowship. Anyway, so in an attempt to regain that control, they might incur into this type of thing. And unless we are open about it and say, well, what medicine you take? Anything else that is not medicine, herbs, supplements, whatever thing, I need to know. And not only to document it, but actually to go and look if whatever they're taking will mess up with the plan that I'm instituting.
Yeah.
Okay?
That's actually the hardest part of a lot of that, is to find out whether or not these things are, to find the research and the data behind a lot of the stuff. It's not easy. It's not easy. And the problem, a lot of it is, if there's going to be new stuff every day. There's going to be new compounds, new herbal extracts and that kind of thing. And the only way that we've found that these things have been harmful is after they've been on the market for a while. So basically a trial with the general population. Phase 3, we jumped, was that phase 3? Is that what that is? We jumped straight to that?
One of the things is, especially in the world of globalization and migration, if patients from other parts of the world, it's always really good to inquire about herbal supplements. I can give an example of Nigeria. A lot of people take herbal supplements, and that's one of the biggest causes of chronic kidney disease because they're really toxic and they affect your kidneys and the liver. So if you have a patient, from out of the country, just don't assume it's a thing before you're prescribing. It's good to find out about this thing.
And a lot of those are not on the market. They're grown in their own backyard.
Right, and they're not going to tell you because
with you, that kind of thing.
either they're not going to say it because they're either not going to say it because they just believe that it's just the norm, or they're scared to tell you. And you just have to be open about it. It's a difficult conversation to have sometimes.
You gotta remember, when these new things come on, there's a sign with it. Cures everything,
Yeah.
and it cures nothing, makes them all worse, that's finally got back at home.
Vitamin E did that for a little while. Vitamin A was that for a little while.
I always used to do that before they lose their effect.
Vitamin D is the new one, I think. We'll see what that ends up doing.
I think it's also important, like as physicians, you have to counsel them when they come in, rather than saying there's nothing I can prescribe for you. Like when we have our infants, our 1-year-olds that come in, like it's just a URI, it's okay. But they're the ones that are losing sleep. They're gonna be desperate.
Right.
They will go for anything. You're not giving them something. So whatever they find on the counter that says natural, they'll go for it. Like I've gone through like the HYLAND stuff for reflex and like colic. It's having a colic baby is hard, and you will get desperate. You will find anything. It's like, especially
And
when
then
you go
hearing
to
from
like,
your pediatrician that
yeah.
it's going to be okay, there's nothing that we can do, is
Or you
probably
find
the hardest
something
answer to
that
listen
doesn't
to.
work. You go for the natural. So it's like, talk to your patients, have them trust you to tell you, and you go through the options together. Be like, let me research it for you, find out if it's safe, and yeah, it's important.
And acknowledge that those things exist. That's the other part. When you're talking to your patients about it, say, there's all these things that you can buy over the counter. Here's the ones that are okay that I actually recommend, and everything else be worried about, or at least be skeptical.
You'll find that parents give their children things that sound strange. I mean, I had a patient with nephrotic syndrome, and the parents were insistent that their child needed to drink, 4 ounces of bovine colostrum every morning. I mean, some of these things are things we never think about, but you can buy these things online. You can buy that kind of stuff from local dairies. You do have to be open and ask in a non-judgmental way. And most of the time, they'll tell you what they're doing.
In general, the internet's not our friend when it comes to this stuff. It is extremely hard to fight it. Those anecdotal stuff it looks amazing, and it's got flowers on it and all natural, and that's what patients look at. I mean, look at the fruit juices that are out there now. Look how bad they are, but you know how hard it is, even those things, to get off, just because it looks really nice. It's all natural.
But they're organic and non-GMO, so they're okay.
Yeah.
Still like 50 grams of sugar, but it's okay. It's an organic sugar.
So faculty and residents can just stay in here. Students and all service can go.